Welcome to our nursing cardiology quiz. Let's put your knowledge to the test. In today's challenge, we're covering 4 essential areas of cardiology: anatomy, lab values, cardiovascular medications, and electrocardiogram. There are 3 questions per topic, 1 easy, 1 medium, and 1 hard, worth 1, 2, or 3 stars. After each question, we'll give you a moment to think and then we'll reveal the correct answer, along with a quick explanation. Ready? Let's dive in. Which combination of vessels drains into the right atrium?
There are 3 main veins that empty into this right atrium. We have the superior vena cava, which is going to be returning blood from regions above the diaphragm. The inferior vena cava, which is going to be returning blood to the heart from regions below the diaphragm. And then we have the coronary sinus, which is going to be returning blood from the coronary veins in our coronary circulation.
Why is less of the left ventricle visible from an anterior view of the heart?
You'll notice from an anterior point of view, though, we don't see as much left ventricle. That's because the heart is not only a little bit off to the left, but it's also rotated a little bit so that it points to the left. So that from an anterior point of view, you see a lot more of the right heart than you do the left.
What is the primary anatomical difference between the tricuspid and mitral valves?
And here we have a mitral valve. It looks similar to the tricuspid valve, except instead of 3 cusps, we have 2. We still have chorda tendineae, and we still have papillary muscles, but we only have 2, the anterior and posterior sides.
Which laboratory test is the most specific and commonly ordered cardiac biomarker for diagnosing myocardial infarction?
So troponins are the most commonly ordered and most specific of the biomarkers. So the other ones can be helpful, but troponin is going to be the most specific. Now this is a group of proteins. They're found in skeletal and cardiac muscle, and they control muscle contraction.
An elevated white blood cell, leukocyte, count shortly after an MI most commonly indicates.
Now, there'll be an inflammatory response to infarcted tissue. So if there is dead tissue, you will see a response or a change in the CBC as evidenced by an inflammatory response. So look at the leukocyte count. Anticipate an increase within a couple hours of the event and a peak within 2 to 4 days. Does that mean the patient has an infection? No, it's part of the inflammatory response. That's why it's really important you understand how to look at the results of a CBC and a differential.
Which electrolyte changes are expected after an MI due to the stress response and catecholamine release?
Now, electrolytes after an MI can also be different. There's a release of epinephrine in that stress response, and it causes a rapid influx of these electrolytes out of the bloodstream and into the cells. So you're thinking after an MI, got epinephrine, the catecholamine, it's going to cause the response where these to rapidly infuse out of the bloodstream and into the cell. Now, when they go into the cell, if I drew lab work, these levels will be lower. We're talking about things like potassium, magnesium, and calcium.
Which naming clue helps identify beta blockers used to treat angina?
The second of the four families are beta blockers, like propranolol, metoprolol. Those both end in olol. Remember, that's a clue when you're studying medications. The generic name of beta blockers have that olol response.
Do vasodilator medications dilate the arteries or the veins or both?
Okay, it was a little bit of a trick question. Vasodilator drug groups have one of three specific targets. First one is primarily the arterioles. Wait a minute, the question said arteries or veins. Well, arterioles are just the tiniest branches of the arteries. So if we can impact those, if we can vasodilate arterioles, you're going to have a really significant impact on blood pressure. It's definitely going to lower your blood pressure. So when you see the words artery or arterioles, they're part of the same vessels, just arterioles are those tiny little branches that have a really significant impact on blood pressure. The second group are primarily the veins. So vasodilator drugs might go after just the arterioles, remember small branches of the artery, the veins, or both.
What is the primary nursing concern related to the first dose effect of ACE inhibitors?
First dose effect means that they're going to have a whoop, like a precipitous drop in blood pressure. So whenever you see a test question that talks about the initial dose or the first dose, particularly if you know if it's a blood pressure medication, that's what you're worried about is whoop, that really big drop in blood pressure.
What does ECG amplitude represent?
So let's talk about amplitude. Now that is the height of the wave when you looked at it as a graph. So the amplitude of an R wave is measured in millivolts. Well, that's convenient, right? Because we know 1 millivolt is how many millimeters? Good job, 10 millimeters. So amplitude is kind of how far that wave has moved the stylus above the isoelectric line.
Which cardiac rhythm is shown in the following ECG?
At first glance, we definitely know something is wrong with this ECG. But what exactly is it? Let's take a closer look. Whoa! This ECG is ventricular tachycardia. It looks significantly different than normal sinus rhythm.
A patient has an implanted pacemaker. How should ECG electrodes be placed?
You may see somebody who has a port, who's receiving IVs or chemotherapy. You might see somebody who has an implanted device like a defibrillator or a pacemaker. Make sure that you don't put the electrode right on top of those, okay? That's going to mess with the conduction. So make sure you try and get it in as close to the right spot as you can without being on top of another device. In fact, try to get them about 1 to 2 inches away from any of those devices.
That's it for today's quiz. Count your stars and let us know how you did in the comments. Keep mastering those core concepts of cardiology, and we'll see you next time.